Work is the best antidote to depression. That is what I found.
Hi guys, and today we have a very special guest, Dr. Malhar Shah, a dermatologist. Thank you for joining.
Thank you for inviting me, Shivam.
So today we will be talking about Medicos life depression. So let's begin. Firstly, why do medical students slip into depression?
See, depression is more common in postgraduate students rather than an undergraduate student. In post-graduation, there can be many reasons, like hostel life is there, the pressure of seniors, pressure of patients. Like they are overloaded with work in post-graduation. So that is the main reason. While in undergraduation, there could be recurrent failure in examination, right? There can be ragging by seniors. The food is not right. The hostel life is not right. So these are the reasons why people slip into depression. But most commonly, it is like adjustment type disorder, which is the most common thing in medical life. It varies from individual to individual as the phases of life in medical people, in medical life, because if people are scoring high, if people get the branch of their choice, then they are less likely to slip into depression, provided there is appropriate environment in which they are working. Okay. But if I like dermatology and I have to take up pathology, then I might slip into depression because that is not my choice. But I need to take the branch in post graduation. In undergraduation, like they are surrounded by lots of people, so it is less likely that they sleep in depression for undergraduate people. In postgraduate people, they are more likely because they are isolated. They are surrounded by patients. They are surrounded by all the ill words of patients and sirs and professors and whatnot. They don't have time to take lunch. They don't have time to take dinner. So they are like always hungry. They are starving. They have to do this much of work. So it varies from branch to branch and from person to person.
Okay, and how did you deal with this depression and manage to come out of it?
So, like basically, in starting of my residency in dermatology, in first 2 months, I was having adjustment disorder with the branch as well as the environment. So I just took a 7 day rest time from my work, and I started analyzing the things that where I am going wrong, and I found that it was not like depression. It was more like I am not adapted to the work or adapted to the environment or adapted to the people and patients. So I started training my mind in those 7 days that I need to do this and I need to do that. So it was like a little bit hard for the first 5 to 10 days, but really got out of it very soon because like work is the best antidote to depression. That is what I found. You do your work and you get out of depression.
And what advice would you like to give to the students who are depressed during this life based on your experiences?
Yeah, see, so it's very easy to get depressed, okay? So, but it is also very easy to stay out of it. So you should always maintain your positive thought. Not on you should not never let a negative thought enter your mind. See, and depression can be because of two things. First, because of your own, and second, because of the surroundings. Your brain, it is a very powerful organ. And it is like a hard disk. If you should only let important things go in your brain, not everything. If you are depressed because of other people, you should start bypassing your information from one ear to another ear. You should not never let this go into your brain. And if you start ignoring things, what other people say, you will never get depressed. But if you are depressed by your own, then you need to realize that what is going wrong. What thought process is going wrong, because it is basically a thought. Depression is not a physical thing, it is a thought. So what thought process is going wrong? You should see motivational videos. You should see videos on YouTube. You should see inspirational movies. You should always be with your friends and family. You should never be alone. First and foremost is that you should never be alone. You should eat properly and sleep properly. And if necessary, then you should also consult a psychiatrist. I also consulted once, for what I was having, and it is not that bad thing to consult a psychiatrist. Okay, so if it goes severe, then you should also consult a psychiatrist to have right medication.
Okay, so those were few words of wisdom from Dr. Malhar, and I'll cut this video here. It was a great conversation. Moving on to the next videos. Thank you, Dr. Malhar, for your time.
Thank you, Shivam. Thank you, Shivam.